We're back. We're live. It's 1 o'clock rock here on Community Matters. And we have our old friend Brad Wong, MD, and Colleen Minami. And they're both with Aloha Medical Mission. Colleen is on the advisory board, of Aloha Medical Mission. And she's been there since 1921. No,
I wish I
was. Welcome to the show, you guys.
Thank you very much.
We're going to talk about dental today. That's why we're calling the show Aloha Medical Mission Goes Dental. You may not know this, but Aloha Medical Mission does more than go to Nepal and the Philippines. They go to Kalihi Palama, and they do dental there. So tell us about the beginning of your dental experience, Brad.
Well, it goes back to when we were founded, 1983. You've heard this story before. A bunch of Filipino doctors and nurses went to the Philippines to do cleft lips. And after a while, we realized, why are we traveling this distance and not doing anything at home for the poor at home? So around 1990, 7 years after we were founded, a group of people, Colleen, myself, and other board members decided to start a Hawaii programs project. And we began going out to Mokuleia in a van with Waikiki Community Health Center, bringing in homeless into the clinics.
What were the dimensions of the need out there that made you do this?
The community people were telling us there's a homeless problem, that they weren't getting in the hospital. So we said, let's do something about it. And then we had clinics in Miley, and
there was another homeless shelter called Pier 24. That was a long time ago. And so we set up pop-up clinics there.
These are medical clinics.
Yeah.
And then we got hitched with IHS, and we started with
that's Institute for Human Services.
Right.
And
that's going to be on the final exam, so you better remember that.
So every month we put on a free clinic at their office in Iwalei.
Right.
And eventually we brought in a dental clinic there. So Colleen reminds me that it was 18 years ago that we started this. And eventually we moved into the Palama Settlement building 5 years ago and developed 4 very well-equipped, you'll see pictures of these, dental suites. And the secret of Aloha Medical Mission is that not only do we now go abroad to do missions in various countries, we started in the Philippines and we continue to do that, but for 18 years now we have been providing free dental care to people who cannot afford it. These are the uninsured, immigrants, people who are working and don't make enough money to pay for dental care. And you've heard this before, that if you don't have dental insurance, you pretty much cannot see a private dentist. They will not see you.
Oh, they won't even make an appointment?
No, they won't even make an appointment.
Even if you had water greenbacks in your pocket?
That's right. Well, you can, if you tell them I have money, they'll see you.
Yeah.
But for the most part, and this is the same in the medical community as well, most doctors will not see you without an insurance policy.
Because they see it as a financial risk.
You know, and there are many impediments to seeing someone without insurance. And so therefore, a person with a dental problem is relegated with an emergency, pain, or some problem with their teeth, going to an emergency room, which is not
really a dental facility
inadequate
anyway.
place.
Yeah.
80% of the people who go to the emergency room with dental problems, they need to go actually afterwards to see a dentist.
Anyway.
That's what they found.
And then they're back at square one.
That's right.
Now the community health centers now have 7 of them have dental clinics, but their waiting list is long. They may not always be able to see a patient who has an acute problem. And this is Aloha Medical Mission's niche that we fill.
It's a terrible need, a terrible need.
It's a huge need in the
travesty
community.
that we, don't have a system that would provide for them. And I guess the question is, can Aloha Medical Mission make a dent in this huge need? How much of a dent can you make?
Well, we can try a little at a time. So we do help the people that really need help. They come in. Some of them are walk-in, some of them have appointments. But my understanding is now we have like a 2 to 3 month wait list.
Ooh.
And I guess the need is really great because they don't have insurance. And Medicaid provides only for extracting your teeth. It doesn't cover fillings, cleaning.
That's something out of the 19th century.
Well, I think it depends on money, right? And how much money you have. And I guess right now, there's not enough money to cover all of that. It's considered a luxury.
Yeah.
So we're trying to fill that by helping some Medicaid patients with fillings and cleaning. We don't do extractions because Medicaid covers that.
So Jay, I'm going to ask you a question.
Please.
This is your quiz.
Yeah.
So how many adults in Hawaii are not covered by dental insurance?
You want an absolute number or you want a percentage?
Give me a percentage. Then I'll ask you the number.
40.
Close.
Close.
It's
About a
close.
third, 30%.
Yeah.
So that's 430,000 adults. Children are covered, right?
Wow.
So by the state if they're not insured. But a third of the adult population, at least in Hawaii, does not have dental insurance. A
And
huge
Medicare
number.
doesn't cover either. Medicare that's an additional that you would have to pay out of pocket.
Yeah.
So you can be elderly and with Medicare, but you have no dental insurance.
It's a terrible situation.
It is.
But Aloha Medical Mission, can you tell the people what your business model is? You're a charitable organization, you're a nonprofit. How do you raise the money in order to provide the services we're talking
We
about?
depend, we depend on
It's
this lady
Colleen,
here.
isn't it?
Yeah.
Yeah.
Yes.
Okay, Colleen, tell us.
Colleen is a millionaire.
All right.
Colleen is our grant writer.
Yeah.
And she rents the grants for
Did you say
300.
ranch the grants?
I write the
got it.
grants. And we've been very successful in the last 3 years. We do have staunch supporters of the clinic. Shall I mention them?
Shall we mention them?
Sure.
Hawaii Dental Service Foundation, HMSA Foundation.
Very nice.
Queens has even helped us.
That's good.
Kaiser has helped
That's
us.
great.
We have other foundations like McInerney that have also been very good. And Omidyar, Ohana
Oh, good for
Fund,
him.
Yeah.
You know, HEI.
They have been very
has
good.
given
HEI has
Alexander
given us.
and Baldwin.
And I guess you met one of our directors the last time.
Yeah, two
So
of them, actually.
we've been
That
very
was a very nice
fortunate.
show we had. Yeah.
We've been very fortunate to get supporters of the concept of a free clinic for people with no insurance or financial means of paying for care.
Okay.
We did get some government grants, so the city has given us some money, and we recently got a state grant.
After all that, why do I feel you're the only show in town that does this?
Well,
Yeah, we're the only free dental clinic
Right.
that takes care of this population.
and-
Okay.
and one more thing. I was telling Dr. Sato,
We're going to meet Dr. Osato in a minute.
Right.
You'll see.
we have volunteer dentists, and they are covered. We have insurance to cover them through the federal government. It's called the Federal Torts Claims Act. And so we are looking for more volunteer dentists, and they don't have to worry about malpractice because we do have that since we
Good.
are a free
So
clinic.
they don't have to pay that out of their
No,
own pocket.
no.
But you do pay them a salary to work.
No,
Oh,
it's
they work
free.
for free.
It's all free.
Oh.
That's why we get
We have
that
one
insurance.
part-time dentist
Yeah.
who works more often than the others and who is the director of the clinic. He has other
Yeah.
administrative duties, but the majority of these
Are
dentists are
volunteers.
volunteers.
We
Isn't
have-
that nice?
It's
of them?
amazing.
That is so nice.
It's wonderful to have them because we could not continue the clinic in the way we have if not for our volunteers. And you know, we started out with only volunteers. When we first started in '95, they were all volunteers. We didn't have any paid doctors or dentists at that
Oh,
time.
so you've been going a long time.
Long
And
time.
you're still doing it, and
Yes.
you're doing it more than before.
Now, we have 8 volunteers now.
Right.
That's
we
a
have
lot.
8.
We could double that number.
Sure.
We
But
could
you
do-
have the space, right?
Yes,
The
we
Kalini
do.
Palama building, which I have seen, I've seen your facility there. You
No,
could
that's
put
not.
more doctors.
This is not Kali Palama. No, that's.
This is a
Puni has-
Palama settlement.
Palama
Our clinic
Palama
is-
Settlement
That's
House.
in the
yeah,
background
yeah.
right now.
That picture right
Right,
there, that's
right,
it.
that's
Yeah,
it.
That's the front door. you
That's
see
the
there.
front door. But we could use more volunteer dentists.
Yeah.
That's for sure.
Yeah. Okay, so suppose I am a corporation and I want to do good, okay? And I want to do good for the state of Hawaii and for all the people who are disadvantaged and need to have a volunteer dental clinic. Why don't you take a look at camera number 1, right over there, and tell my corporation what it should do now in order to support you.
Okay. What I would do is do a proposal to you and give you all the facts that we have regarding the numbers of people with no insurance. I can also give you the facts of how many we've seen in the past 18 years. how many people we've helped, and we also do a survey of our patients, so we can tell you what they've told us regarding the services they've gotten. We have another program, it's called Welcome Smile. It is for women who have been abused or incarcerated. And if you know or seen these women, they have gone for 20 years with no dental care. And many of the abused, they've had their front teeth knocked out, they're in bad shape. What we do with the money that we get for this program is we try to put in temporary prosthetics, and so what happens is they can then go out, go for a job interview without being ashamed of smiling and talking.
I want to follow up on that point with Brad. We only have a minute left here, but you know, you're a surgeon, super surgeon, in my view. The state's super surgeon right here among us, yeah. So Brad, you know, dental health means something to the larger picture of health, doesn't it?
Yes.
Can you tell the people how important it is to have dental health? Use camera 1 or 2. 1, 2.
Well,
Okay.
10 years ago, it wasn't, the importance of dental health and hygiene wasn't really recognized in the medical community. Heart disease, a bad leg, diabetes were thought to be entities that were unaffected by dentition. But there's more evidence surfacing now that bad dentition and the associated infections, pain, the difficulty in eating and maintaining nutrition affect one's overall health. And so higher heart disease, hypertension,
Poor pregnancy
diabetes,
outcomes.
a number of across, and things that have not been studied yet, I'm sure are going to be, diseases are going to be found that have a link to poor dentition. Now, all of us, you included, probably have very good teeth. And that's because our economic upbringing allowed us to have regular dental care. But the people that we see, and the people that I've seen in other countries, have such horrible teeth, it is really incomprehensible to the average citizen in the US how bad teeth can be. And now it's not so secret for the people that are poor, who have not had regular dental care, and for the dentists who see these. It's not a secret that there are really bad teeth and bad mouths out there that severely limit not just a person's job, livelihood, and everyday life, but their health. Your entire life is affected by
your quality of life,
yeah.
your mental state.
Right.
If you can't chew because of pain, that really impairs your ability to not just enjoy a life, but to earn a livelihood and to take care of other people in your family.
I don't think people realize that, and I'm so glad we covered that. But now we're going to take a break. That's Brad Wong and Colleen Minami from Aloha Medical Mission. Here on Aloha Medical Mission Goes Dental. We'll be right back.
Aloha and welcome to Think Tech Hawaii. I am Ina Chang. I am the guest host for Small Business Hawaii with Reg Baker. Tune in every Thursday at 2 p.m. and watch us. Aloha.
Aloha! We invite you to join us on our Keys to Success show, which is live on the Think Tech live streaming network series weekly on Thursdays at 11 a.m. My name is Danelia, D-A-N-E-L-I-A.
And I'm the other half of the duo, John Newman.
Our goal for our weekly show, Keys to Success, is to provide professional and personal development tools and profound insights on how to achieve success in life, career, and/or business.
We have a theme focus for each show, and our guests have achieved success in their life, career, and our business. They are frank and candid with their advice and commentaries.
As this is a live show, we have live mess-ups as well, which are fun to watch.
As you see.
Resources, success tips from our guests, and other information can be accessed at newmanconsultingservices.com or Danelia, D-A-N-E-L-I-A.org. We also invite you to call us to join our weekly conversations or tweet us if you have any questions or comments. We want you to participate in the show. I'm Danelia, D-A-N-E-L-I-A.
And I'm John, the other half of the duo. We're looking forward to seeing you on our next Keys to Success show, aired live Thursdays at 11 a.m.
Aloha! How you doing? It's me, Angus McTech, wishing you to welcome and join us to see us on Hibachi Talk on Think Tech Hawaii. Join my co-hosts, Gordo the Tech Czar and Andrew the Security Guy, every Friday from 1300 to 1345. We look forward to seeing you. We'll talk tech and we'll have some wee bit of fun. And remember, let your wing gang free wherever you be. Aloha!
You're watching Think Tech Hawaii, offering lifelong learning from passionate hosts and fascinating guests ready to explore and explain Hawaii's place in the 21st century. Great content for Hawaii from Think Tech.
Bingo, we're back. We're live. We're here at the Kalama Settlement House, actually, in the downtown area. We're in Pioneer Plaza. I was only kidding. Okay, and I'm Jay Fidel, and we have with us the second shift on Aloha Medical Mission Goes Dental here on Community Matters. We have to my left Dr. Andrew Alamar, who's a dentist, and to his left Kiana Imperial, and that she's there because she's a dental assistant. She's there because we always have gender sandwiches here on Think Tech. And to her left, Dr. Mendel Sato, two dentists. How come you have the blue outfit and he doesn't?
I was practicing this morning.
Okay, all right, see, you came right off the firing line
Right off
for
the
us.
firing
All
line.
right, thank you. So what's it like, the firing line at Aloha Medical Mission Dental?
It's great. Every day is interesting. Not only do we have scheduled patients, we always get quite a few walk-ins, and you just never know what you're going to find.
Can you take walk-ins? They must have serious conditions for you to take them.
99% of the walk-ins are in pain. So it could be anything from a large, what they call palatal abscess.
That hurts.
That hurts
even thinking about it.
That hurts and it's dangerous.
Yeah.
To just a tooth that should have gotten a root canal a year ago that patients have been living with that needs to come out now.
Yeah.
So you just never know. And it's fun.
Fun, but why do you do it? For the fun?
I do it, well, obviously just to help patients.
Yeah.
I mean, that's number one. You know, you're helping people. It's interesting.
You get to engage with them? You get to talk?
Oh, absolutely.
Are they
Absolutely.
appreciative of the help you give them?
It's so rewarding, especially when patients tell you, they didn't feel your injection. Because a lot of people, they won't go to the dentist because they're afraid of that needle.
Sure.
I mean, I used to
Everybody worries about dentists.
I used to treat Marines, and that was their worst fear, the needle. So
That's perfect. That's a great story. So, do you do all kinds of things, or do you stop short?
We're somewhat limited as far as services that we could provide. We do cleanings. We have a hygienist. We do fillings. I do a lot of surgery. Fillings, of course. We have this Welcome Smile program. Now, I'm a fully trained prosthodontist, so
What is that?
I'm trained in doing oral reconstruction, dentures, implants, so on and so forth. And one of the reasons they hired me is because we have this Welcome Smile program, and which was already alluded to, where we do dentures for recently paroled females and also battered women. So we get women in with no front teeth.
Because they've been hit.
They've been hit.
Huh.
So they're trying to get employment.
Yeah. They need that for sure.
They need front teeth.
Yeah.
Right.
Yeah. It's hard to get a job without front teeth.
And you
I
just
heard
wanna-
that here on Think Tech. It's
Yeah,
true.
Yeah, and of course, self-esteem. You want to look good, and you want to function. You want to be able to eat.
Yeah. Yeah.
So,
Oh, wow. How many hours a week do you put in on this?
I work 20 hours.
Do you have a practice, your own
I
practice on
do
the
not.
side?
I recently retired after 28 years with the U.S. Navy, and my last duty station was here. So my wife and I and my children, we decided to stay in Hawaii.
How nice that you did. Yeah. So are you being paid anything?
Yes.
You're the only one.
As far as I know, I'm the only dentist. I have a dental assistant that's paid. Our hygienist is a paid hygienist, and Kiana, who
One of the paid assistants.
one of the paid assistants.
Yeah, yeah. Is this your career now in retirement?
Yes and no. I may do so. It depends on when my wife gets tired of me hanging around the house. So I may have to go out and look for some more
Okay.
gainful employment. But
All right, well, thank you. Let's go to you, Kiana Imperial. I understand your family is very imperialistic.
Yeah, it's just a Hispanic last name.
Tell us, you're a dental assistant. What do you do at Aloha Medical Mission Dental?
What I do is I assist the doctors working on the patients, and we have to work according to their time schedules. With Dr. Alamar, I would come in every Thursdays to help him out in the morning, and with all the other volunteers, I will come in on their time.
Yeah.
So whatever time they can offer in the clinic, I will come in to help them.
Are you volunteer?
No, I'm paid.
Okay, and how many hours a week do you put in?
I can put in anywhere from 32 to 39 hours.
Oh, that's a lot.
Yes.
Okay, and do you have other work, or is this it?
Well, I'm a part-time actress out there in the public, but I do a lot of the dental assisting at Aloha Medical. It's a very, very challenging position.
Why do you say that?
Like when Colleen mentioned that we are the only free clinic, it can be very demanding. So a lot of times
Why
I
is
spend...
a free clinic more demanding than an ordinary clinic?
Well, there's people out there that are in need of dental care. They lack insurance. There's a lot of low-income families and single people out there. So they need to come into the clinic to get dental work. Most of them have medical, but they don't have dental insurance.
Sure. Yeah.
So the time is very demanding.
Why do you do this?
I do it because I love the medical field, the dental field, and it's really rewarding seeing how the patients come in. Their teeth are pretty much disintegrating. They're in need of dental care. They're in pain. And when we work on them, it really is rewarding to watch the transformation. It's interesting to see while the dentist is working in a patient's mouth, you start from pretty much scratch with a tooth that's broken, a tooth that's gone, or a tooth that's cracked, a tooth that's rotting, and you watch the dentist transform it into something beautiful. It's like artistry.
Yeah, wow. I bet you guys love to hear somebody say that. It's a science, but it's also an art.
It's an art.
And you're making something beautiful. And it's even more beautiful in the mouth of somebody who can't afford to get it anywhere else. So what's the role of the dental assistant, in the clinic? I mean, how important are you to the dentists? And I'm going to ask these guys how they feel about that also.
Well, my role as a dental assistant is highly important to the dentist in that they're doing the doctor part of the work and we're assisting them with their clinical work.
Yeah. Could they operate without you?
It
You get head shakes no on both sides here.
depends. Our doctors, typically the dentist would need an assistant because they're working on a time schedule. There's a lot of materials that need to be mixed, a lot of materials to be made. If the doctor has never been on a mission, he's not capable of working on his own. So they need an assistant. For a doctor that's gone on a mission, however, they're pretty much always working alone.
So they're more used to that.
Yes.
Let's go to Dr. Sato, Dr. Mendel Sato, also a dentist at the Aloha Medical Mission Dental Clinic in Palama. What's your experience like there? How much time do you put in? What kind of cases do you handle? And how exactly do you feel about Kiana Imperial?
She's a great assistant.
Okay.
Can't function without her.
Okay, all right, yeah.
I'm a volunteer there. I go there twice a month on every other Wednesday.
You have your own practice on the side?
I do. Yeah. And I'm a general dentist, so that's my training, and that's what I see and do at Aloha Medical Mission at the Palama settlement. I think most of the cases that come in are of need for general dentistry. So that's where I fit in, and other general dentist volunteers. Dr. Alamar is a specialist, and his skills are definitely needed in situations like for the abused women and incarcerated women.
It's hard to find somebody like him.
Yes, oh, absolutely. General dentists, we make up most of the dental profession, but the specialists are, especially prosthodontists, they're trained very well in treating difficult cases, and there are many difficult cases that come into the clinic.
So what's the difference between, the ebb and flow of practice at the clinic and the ebb and flow of practice in your private practice?
Well, because it's a volunteer position for one, and it's a free clinic, there's no economic stress or production stress put on to produce. However, there are different types of stress that is associated with a clinic like that. For example, we're limited in our scope of what we can do. So in situations where, let's say, for example, we want to either do an extraction on a Medicaid patient or do a root canal, perhaps, we don't do root canals. So, but that's just the nature of the game here, that we have to follow certain rules. But the need to take patients out of discomfort and to treat them still exists, and that's what we do. In private practice, of course, as anyone can tell you, there's always a time factor for one and an economic factor that we need to do. So as far as need for dental work, there's definite need at Aloha Medical.
Yeah.
There's no question.
Well, it's like a barometer of the society in general. It's the safety net, it's the disparity of income. Dr. Alamar, I'd like to offer you the opportunity to close here. And if you look at camera one, and tell my corporation, who is considering making some kind of charitable tax-free donation to Aloha Medical Mission for this dental clinic, what would you tell my corporation?
I think Aloha Medical Mission Dental Clinic would be a wonderful place for you to invest as far as a charity. We do a wonderful service. Unfortunately, when it comes to Medicare, Medicaid, for some reason they've divorced themselves from the mouth. I don't know how you do that. So there's a lot of patients out there that just can't. Dentistry is expensive. There's a lot of dental patients that can't afford dentistry, and they put it off, and when they finally come to see us, the need is so great that we just need as much help as we can get.
Thank you so much, Doctor. Dr. Andrew Alamar, Dr. Mendel Sato, and Kiana Imperial from Aloha Medical Mission. Aloha Medical Mission goes dental here on Community Matters. Thank you so much, and thank you for doing what you do.
Thank you.
Thank you.